So how do we diagnose menopause? I think what we're really asking is the question, how do we diagnose that we're in the perimenopause? Because the menopause is your last period. So how do we diagnose it? Now, the NICE guidelines state that any woman over the age of 45 years, if she's got symptoms of perimenopause, like hot flushes, night sweats, irregular periods, then we don't need to do any blood tests. So if you have symptoms suggestive of the menopause, then actually you don't need to have any tests, and it means that you are going through it at this moment in time. 5% of women will naturally go through it under the age of 45. And so sometimes we may need a blood test, FSH blood test, to see whether or not you are or you're not. However, that blood test can be a little bit misleading and can be a bit confusing, because if you are perimenopausal, which means maybe you're having irregular periods or shortened cycles, then one day when you do that blood test, it can come back absolutely normal. Another day, it may be sky high. And how it's diagnosed is if the level is above 25. That's for most labs. Some labs it may be 30. So if you have a reading above 25, most likely you are in this menopause transition. However, if yours comes back normal, then your GP or your doctor may then choose to repeat that test, or should repeat that test 4 to 6 weeks later. But on the whole, it's mainly based on your symptoms. It's about you as a woman, not about the numbers. And 1% of women will go through a premature menopause under the age of 40. And obviously there are those women who may also have what we call a surgical menopause, because they may have had a hysterectomy for a number of reasons, or women who've had chemotherapy or radiotherapy. They can be thrown into menopause, sort of almost overnight.